If a patient has mitral regurgitation, that means some of the blood in the heart leaks back into the left atrium instead of going forward. Like and subscribe if this is helpful. We've got a 58-year-old man. He's got long-standing hypertension and type 2 diabetes. And he's got dyspnea, and he's got some fatigue, and he sleeps with 2 pillows at night. And he's becoming winded after walking a short distance. He's on several medications. Which of the following interventions would help increase the ratio of forward stroke volume to regurgitant? Okay, regurgitant volume. So what's happening here is we have less blood that's getting to the body, and that causes his fatigue. And the blood is going to back up into the lungs. That causes his shortness of breath and his crackles. And so we want more blood to go forward toward the aorta, that's a good direction, and less blood to go back, that's in the atrium, that's a bad direction. So let's look at these answer choices here. How do we fix this? The heart wants to send blood to whatever direction has least or more resistance. What do you think? The least resistance, like water, always follows the path of least resistance downhill. And so if you decrease the afterload, then it's going to help the blood flow forward. And so the aorta is like a stiff hose. It's got a high resistance, right? The leaky mitral valve has an open hole, right? The mitral valve does in this patient's case because he's got some mitral regurgitation. And you can see that there's hollow systolic murmur at the apex that's radiating toward the back. All right, so he has a little bit of regurg. And so how do we solve this? Well, we need to change the pressure. We need to lower the pressure of the aorta using a medicine. And let's figure out which medicine we should do. Nitroprusside. Right? If we did some nitroprusside, what would that do? It would relax the blood vessel, and the heart would make it easier to send blood forward. What about beta blockers? If you gave him beta blockers, what effect would that have? That would slow the heart. It would not be helpful, right? How about B, increasing the left ventricular end diastolic via fluid? Okay, so if you give him fluid, that will just increase the total blood. That would make the leaking worse, so no. Intravenous administration of isoproterenol or dobutamine. Those are 2 answer choices. Those would make the heart squeeze harder, but that would not fix your problem with the flow. The blood will still leak backwards, and we're looking to change that proportion. So we drop the pressure in the aorta, we lower the afterload using vasodilators like nitroprusside. And that's going to be our answer to this question. So I'll go ahead and do a little boom, check that out. And like and subscribe if you want more content.